Okay, I think we'll go ahead and get started as people are returning to their seats. Very excited for this panel and for the agenda on the day. As Neil said at the beginning, preparing for this has made me very optimistic about where we are and all of you who are working on advancing child care policy. So I am Chloe Gibbs. I'm a senior economist at the W.E. Upjohn Institute for Employment Research and faculty at the University of Notre Dame. I am a policy fellow here at SIEPR, and I served at the White House with the President's Council of Economic Advisors from 2022 to 2023, handling the child and family policy portfolio. And I have the pleasure of moderating this session on lessons from both federal and state level ECE policymaking efforts and what we've learned about those policymaking efforts and about implementation. I'm joined by a great panel who I could spend the whole time we have telling you about their vast experience in this area. So I'm going to give you a snapshot, a condensed snapshot, and you can see their bios. But moving from your left to your right, first, Mario Cardona is partner at EducationCounsel, a mission-based practice within the Nelson Mullins law firm. Previously, Mario served as a senior education advisor at the White House Domestic Policy Council for both President Obama and President Biden. We overlapped at the White House and worked together, although not often in the same room, mostly on Zoom. He also served as the policy director for the Children's Equity Project at Arizona State University, the chief of policy practice and research for Child Care Aware of America, and as a senior aide in the United States Senate. Next to Mario is Janet McLaughlin, who has served as deputy commissioner at the Vermont Department of Children and Families since March 2023. In this role, she oversees the Child Development Division and has responsibility for Vermont's child care system in early childhood education and after-school settings, children's integrated services, and universal pre-K in partnership with the Vermont Agency of Education. Prior to that, she served as the chief programs officer, interim CEO, and chief operating officer at Let's Grow Kids, and as the executive director at the Vermont Association for the Education of Young Children. And finally, Sara Mickelson is now an independent consultant, has over 15 years of executive leadership experience in the early childhood sector. Previously, she served as deputy cabinet secretary for the New Mexico ECECD, we learned the acronym, established the first early childhood office in Harris County, Texas, and served as chief of programs and chief of staff for the Oregon Department of Education Early Learning Division. She currently serves as co-chair of Oregon Governor Tina Kotek's Roundtable for Universal Pre-K. So I'm delighted to have this great panel here with us to talk about their experiences in policymaking. And to kick us off, I think we'll probably start with Mario and have everyone tell us about, and this is a bit self-interested as a researcher, but I'm curious if you could tell us about how data, evidence, or database projections have been useful in policy design or in the refinement or implementation of policy. And if you have specific examples, I think they'd be super useful. So Mario, maybe you could kick that off for us.
Sure, I'd be happy to. And first, before I start, I just want to say thank you so much to Neil and the team here for inviting us to participate in this conversation. And really very grateful to Chloe for moderating too and being alongside these great panelists. I was thinking about a lot of different examples actually, and I wanted to offer one that Chloe and I worked on, just so we can bring it home in that way. So some of you may remember that during the Biden administration, there was a push to make more permanent the emergency dollars that were made available during the pandemic as a part of the American Rescue Plan Act. And as a part of that, there was a lot of advocacy around pushing for an additional $16 billion a year, people may recall this, for child care. And there was a lot of pressure that was put on the White House to make that request. And people within the White House understood that there was a cliff that was coming or approaching with the expiration of American Rescue Plan Act dollars, and wanted to see what the real figure was. So like the advocates had come up with $16 billion mostly by taking what they viewed as an annualized version of all the relief dollars and giving that figure. And so in the White House, we're like, well, what's the actual figure? Like, what do you actually need in order to shore up childcare? And so we worked closely with our colleagues at the Council of Economic Advisors, and they looked at a few different measures, and they're like, well, if you want to return to pre-pandemic expenditures and revenues, if you wanted to maintain wage growth, if you wanted to bring in mothers who are not currently participating in the workforce because of childcare issues, it'll cost about $15.9 to $16.2 billion a year. That's how much it will cost. So we arrived at the same figure as the advocates, but in a different way, and in a way that made the policymakers within the White House more comfortable advocating for that figure. And so that is what led to the president to ask for that recommendation as a part of a supplemental budget request. And it just happened to fit neatly within what the advocates were requesting and a bill that was already being proposed in Congress. So that was some of the internal case making that we needed to do in order to get principals within the White House on board with the idea of asking for pretty significant new dollars in child care. But then as a part of it too, on the external case-making side of things, we also wanted to show people why those types of investments were important to make and to continue. And so again, we worked closely with our colleagues at the CEA to say, well, what has been the impact so far of the Stabilization Act, or the Stabilization Program dollars from ARP? Has there been any sort of immediate impacts on the economy? And so they got to work and they said, yeah, there have been some pretty significant impacts. And so they wrote a really excellent scholarly white paper. It was about like 35 pages long. And they determined that the investments that were made as a part of the stabilization program led to a reduction in the price of childcare of about $1,250 per child per year. That it sped the return to work of about 100,000 mothers with young children, and it led to wage growth among childcare providers of about 10%. And so we took those insights from that 35-page paper and ended up putting it into like a 3-paragraph press release, and used that as some of the work that we did to get people behind the idea of trying to make that that recommendation real. We ended up not being successful in getting that money. But I just wanted to offer it as an illustration of like how some of these things end up happening and how people approach some of the policymaking that they tried to do. And also, it wasn't a foregone conclusion that that $16 billion request would have come out of the White House, because people were pretty skeptical about that figure until CEA gave us the hard numbers behind why it was important.
Great. Janet? Great. Thank you. I'm so glad to be here. In Vermont, the state has really coalesced around childcare as a bipartisan and multi-branch issue over the last decade. And it really rose to the top as an issue that mattered to Vermonters and ultimately one that we could actually make progress on, which is important from a policy perspective. Governor Scott is really focused on affordability for families, protecting the most vulnerable, and growing the workforce, right? And childcare is one of those things that just ticks all the boxes. In terms of data, I think there's 3 specific examples I'll share. First, one of the early efforts was a Blue Ribbon Commission on high-quality, affordable childcare, right? So this is just one of those sort of like statement bills, pull together the committee, do the work to build a shared definition of what high-quality childcare was, and then put a price tag on it for the state. And it was really important part of socializing the fact that what's needed is big investment, right? So that, and again, Vermont, teeny tiny little state, only 650,000 people in the whole state, second oldest state in the nation, so there's not even that many kids in it. But all of the kids are wonderful, including mine, and important, right? They're all important. And so, that helped socialize in the state that, right, instead of spending $50 million a year on this, we needed to be spending $250 million a year if we wanted to achieve what we wanted to achieve. So to that extent, 5 times as much money, right, whatever your starting dollar is. The next thing was doing supply and demand analysis. And again, you can do that in very fancy ways. Ours was not so fancy, I don't think. We, the Child Care Advocacy Group, really put this together using the public data to just paint the picture, using licensed child care capacity, and then using labor data around number of children with all available parents in the workforce, which obviously showcased that like tremendous undersupply in the state, and especially for infant and toddler care. And that was such an important tool to begin the conversation about why programs weren't just like popping up to meet the demand, right? And that they couldn't just expand and start within their current financial reality. And like I said, it was a really critical tool, and business leaders especially really responded to that information. We did have to, there was a number of business leaders who really felt like if they just could get in there and do the figure it out, they'd figure it out, right? But we did the work. We literally had to have a 2 to 3 year work group with business owners to help them see that it's not just that you can connect the pipes differently. There's not enough water running through the pipes. It will not work, which got them on board. And then finally, we did a later step was an early childhood and education financing study. RAND did that analysis for the state, and they were looking at how much it would cost per child, different ages, to support adequate rates. They also looked at how much it would cost the state to provide subsidies, aiming to keep costs under 10% of income for all families. So we, in Vermont, made the policy choice just to aim for a definition of affordable, not fully subsidized, and then to examine what were the potential funding sources in Vermont and how much that would raise. And that was really what the data that the legislature and the governor needed to use to be able to evaluate the policy trade-offs.
Great. Well, thank you for having me. So exciting to be here with this esteemed panel. I was thinking of some examples. I have many. Research is very important, thinking more from the small p policy point of really the day-to-day implementation of the work, and two things really pop up. I think I'll focus on the small implementation, but another thing I think we're sorely lacking but is really helpful is when you're thinking about the big P policy and thinking about research that isn't necessarily responsive to what people are doing here in the United States right now, but helps us create a vision for what we could do differently, I think is really important. And that's, a gap, but I see one that's growing with folks in this room even contributing to that research base. But on the data and research side, there are two things that come to mind. As a public sector leader, you're often kind of grasping at how to make a decision and make it in the right way. I mean, just to be fully honest, you listen to people, you look at data, you think about what you have the capacity to do. And so when there is research right there that helps you make the right decision, it is truly, the most invaluable asset that you can have. When I worked in Oregon, I had started right after our validation study of our fund, which I know this isn't just early childhood people, so I'll say the acronyms hopefully, right? The Quality Rating and Improvement System, which is a system in states that rates childcare, and in most states, I think 48 out of 50, determines the rate that you receive from the state. So if I get 4 stars versus 5 stars, that might mean a few $1,000 a month for me per child, or just in general. And our study showed us, Portland State University did it, that the class, this rating system of how good people were doing in interacting with children, just to put it plainly, was undercounting quality in family childcare. So that research was just invaluable for us to be able to say, maybe this tool isn't sensitive enough for a huge part of our population, and this is costing people hundreds or thousands of dollars per month. So to have that research point and be able to actually make a decision based on that was really helpful. But the one that always sticks with me is when I worked in Harris County. When we first started, it was right after the first round of federal pandemic funds came out, and we were looking at state ARPA fund use. And as a county, we had a vested interest in making sure our county got the most of the funding that was coming out from the state. And we had our research department internal to the county map all of the data of who received what was these very easy to get grants from the state that just gave you a few $1,000s. And there was one neighborhood in Harris County that was just blank. There were licensed child care providers there, but there was no use of state systems. They weren't participating in any state systems, and they didn't receive any of these grants that were really like, click a button, you get a few $1,000s. And so that was a big problem for us. That probably added up to about $1 million lost in a few months' time. And they were all of the Vietnamese-speaking providers in Harris County, mostly were concentrated in this one area. And I'm looking at Angie because Lyft came in a few years later. I had a staff member call. So we did a human-centered design project. We went out there, we did research, we learned who in the community that these providers listen to try to funnel that up. This place called VN Network, and I had a staff member call every single day and try to get a hold of this network. But we would have never known about them if we weren't able to kind of layer data and research together for quick decision making. So I think it's invaluable across the board, but I think the more granular and more real time it can be, it's very helpful.
That's great, and I might follow up on that to say, so what are the major gaps that you've encountered when there is, you actually pointed to 2 examples where the research kind of filled a space for you. Mm-hmm. Where do you where have you looked for that and not had the kind of evidence that helps you as a policymaker? And maybe I'll just start with you, Sarah.
Sure. Definitely in the quality space. I think it's not to say there is not research on quality and what matters for quality, but as a policymaker and maybe like a little bit of a lay person in this area, it's sort of like, well, what does it mean? What does that mean for the decisions that I should be making? Because states put millions of dollars into these systems every year that, frankly, 10 years ago we had these validation studies on, and they kind of said, this system doesn't really work, and we've sort of been stuck in this frozen mode ever since of really how do we meaningfully move the needle to make sure that children experience quality environments every day. What is the state's role in that, and how do you set up a system to solve that? That is the thing that I feel like keeps me up the most at night, is I still don't have a great answer for that. And I feel like that bridge between research and policy, the research may be there, but as a policymaker, it's oftentimes we don't even have subscriptions to most journals or any journal. So to be able to find what the research really says, I think we need to have more person-to-person conversations. And, lastly, I'll just say, I think the other big space is, a lot of the way, I know it's because of the funding environment and how it works, we're studying what is, not what could be. And so I think early childhood, I'm just going to say something I can't cite, but I have a feeling, we're one of the few fields in which we're looking to the public sector to innovate, like to be the innovator. And I think we need more people, and there are certainly lots of people at the table, being a little bit unnuanced and hyperbolic here, who are setting a vision for what could be for policy for childcare. As far as, all we have right now is to look to other countries as far as what they have done to support a robust, universal or close to universal childcare system. So I think our field is really missing at least some sort of aggregate knowledge of visionary research, visionary policy making, as opposed to responsive sort of let's study what is and think about what could be.
Interesting. What about Janet or Mario? Do you guys have examples of gaps in the existing either data infrastructure or evidence base that would be helpful for policymakers, and maybe the researchers in the room can take these up?
Sure. In Vermont, we have made a big investment in childcare recently, and so the two big questions that I'm getting all the time are, well, they're both versions of did it work, right? And they are, right, so like how much less are families paying for childcare, right? And I can point to the fact that we have 72% more families participating and getting subsidy now, and I can share specific case studies, but right, there's that household level sort of before and after like analysis, that's really detailed work that requires a research partner that we certainly don't have that research capacity within state government. And we have many fine institutions in Vermont of higher education, but none of them specialize in early childhood policy. And we do partner with Child Trends on some family surveys, but it's not necessary, it doesn't, which is super helpful. But it's not that more comprehensive analysis. And then the second thing I would say is people are really curious about childcare capacity, right? Like, is it growing? And is it growing at the speed at which you thought it would? And so I can show folks the data and say, we can see we've had this decade-long slide, right, in terms of childcare capacity, and we're turning the curve. We have more programs opening than closing for the first time in a decade, which is fabulous. But people are like, well, but how is it what you expected? And I'm like, we made no predictions, right? There was no model for which we could make predictions on how quickly did we expect childcare capacity. If you invested in an extra, 3 times as much money, how many more slots does that equal? And people want me to have an answer to that, and I don't. So if anybody can help us out.
Mario, how about you?
Yeah, I have a few. I mean, sometimes I feel like it's also hard to get access to like just basic information. And it makes it really, really hard to make informed policy decisions. So I'll give an example. We worked on a policy during the Biden administration to make real this promise of equal access to subsidized childcare related to what's available in the private market that's not subsidized. And so, prior to an interpretation that the Biden administration took, it was the case that some states had set reimbursement floors for home-based providers at like 7% of the market, for example, for certain home-based providers, or 14% of the market rate, which is sort of an extraordinary rate and level. And so, we wanted to propose a policy of like 50% or 75%. what impact would that have? And it was so difficult to just get access to information about what kind of impact that would have in the market. It's like, okay, well, if we do this, like, what's it going to be like in like this state or that state? Like, I don't know. I don't know like the population of providers who are receiving subsidy relative to those who aren't receiving subsidy. So I can't tell you definitively what impact that's going to have. And I'll tell you, as a policymaker, I was like, how can we not have that information? Like, how is it possible we don't have that information? But things like that happened all the time. And there are also things that we require in the law or enable in the law that you don't have visibility into. Like, for example, again, thinking about subsidized childcare, there's an ability for states to seek and receive waivers from the federal government from certain requirements in the law. There's no requirement in the law, however, to have any visibility around any of those waivers. And so it is really challenging to find out what sort of waivers are in place in a particular state unless they make those available. It's also almost impossible to find out what waivers have been denied and for what reason. I don't agree with that from a lot of different perspectives as a taxpayer, as somebody who worked on that policy, but also if there's like a trend or a pattern in the types of waivers that are being pursued, it has policy-making implications. And so we should have access to that kind of information. And so those are just examples that come to mind quickly.
Yeah, that's helpful. Why don't we return to Sara's sort of visionary call for thinking about the future of policymaking. Typically, where our federal policymaking in this space has been really focused on demand-side subsidies, and to a smaller extent, tax credits. But I'm curious, what are the new, innovative, what's the frontier for thinking about the supply side and investments in providers and in the workforce? And Mario, why don't we start with you?
You know, I think that is like one of the biggest policy innovations that we've experienced in like the last 5 years or so, and it came out of the pandemic and the relief that was deployed immediately to providers. And so if you think about, and I know there are a lot of economists in this room, so you probably thought about this, but so much of the support that we provide through Child Care is on the demand side, unless you have contracts and grants, but we have very few of those typically. And so most of the support that we provide is on the demand side through vouchers. And so for the first time, you had at scale massive investments on the supply side. And with also like very, very little constraints around how they use that money. And so it was sort of an experiment a little bit in terms of like how things would end up working out. Now, of course, it's hard to remember the dark days of the pandemic now that we've been out of it, but it was such a difficult period of time, and so many providers were on the precipice of shuttering their doors permanently. And so we wanted to give them as much flexibility as possible. But when you saw how providers ended up using that money to make critical improvements in quality, to make improvements in their workforce, to reach out to certain populations who are eligible for childcare who hadn't been served previously, it had a tremendous impact, as I mentioned before, on labor force participation, on wages for workers, and on price. So I think it is absolutely necessary that we consider what it is like to make those kinds of investments at scale again in childcare, because if we continue to just do what we've been doing on the demand side, it'll never be enough. And so I'm really heartened by some of the efforts by our colleagues in places like Massachusetts who are trying to really go after some of these supply side investments, and I really appreciate two federal policymakers who are trying to put that out in the ether too, because I feel like that is where we have to go next.
Janet, what about in Vermont? What have you guys been either doing or thinking about on the supply side?
I have some thoughts to share, though I'm a little contrarian here possibly, because I am somebody who's really cautious about like innovation for innovation's sake. Sure. And I mean, like the innovation here is just more money, right? Like that's the base innovation. It's like actually paying people the price of the cost of the good that they are selling to society. And our investment really is mostly on the demand side in Vermont. But I will offer, as a rural state, it's been helpful for us to think about what other industries we can learn from, right? What is that comparison? Mm-hmm. And so farming is an example that we look to in Vermont, right? It's something a lot of people understand as a rural state. And, farming businesses and childcare businesses actually have a lot in common, right? They are owner-operated, they're low margin, they're sort of high passion, like identity-based businesses. And when you look out at farmers, you actually realize there are tons and tons of specialized supports available for farmers. They might not admit it. I don't know if there's any farmers in the room. But, right, there's federal and state grant programs, there's dedicated insurance markets, there's a whole cooperative extension system, right? There is a massive system that is supporting this because as a society, we've determined it's an important industry. So, and I would also offer farmers have organized themselves right into cooperatives for centuries as well. So we've been in Vermont trying to look at some of the infrastructure that's been set up for our farmers and think about what we can learn from that for childcare. And so we do have been building out our business technical assistance supports that we have in our capacity building efforts. And we want to make sure that these mostly female entrepreneurs know that like it's okay not to know everything. It's smart to ask for help. It's wise to lean on one another. Like that is the way that you're going. That is a valid way to be successful. You don't have to be go it alone. And so what we've done is we partnered with a nonprofit called First Children's Finance, and they established an office in Vermont, and they offer a ton of business planning, leadership training, HR supports, all sorts of supports for program leaders as business leaders, and that has been incredibly helpful. They're involved with almost every single new program startup in the state right now, and we do fund capacity building grants as well. But they're not at huge amounts, and they're just sort of enough to get you over the hump to get started, but not enough to incent folks to join without a really solid sort of like mission motive as well.
Interesting. And Sara, what do you think about the supply side?
I just definitely want to underscore we are, it makes sense that we build, because that is what our Child Care and Development Fund is largely, I'm with economists, so I'm like supply, demand, I'm getting nervous. A demand side intervention, but thanks to Janet Yellen for saying this is a broken market, because now we can quote her and I don't have to explain it, because I can't. But that increasing demand is not going to fix the market. And so I totally agree with what both of you all have said. I think the folks in Massachusetts who are doing these grants to programs for these, what they call base operating grants that just fund what it costs to operate, make a lot of sense. I think there are still a lot of states carrying the torch on their wage initiative that they started during the pandemic. I think a lot of those, to the earlier research session, are not of a sufficient size to make a huge difference, because folks have to make the hard choice to say, like, I'm working with Michigan right now to do some technical assistance on their wage initiative program. You always have to make the decision: do we want to serve a lot of people, or do we want the amount to be a lot? And I think we saw that with the way people fund subsidy. Now we're seeing that with the way people fund their wage initiatives, is trying to spread a thin pie kind of around everyone, and a $2 raise when you're not making much isn't a huge game changer a lot of times. But I think states are trying, and they're also studying, and they're learning, and they're trying to improve. So I think those are really important things, because trying to build a universal or serve a lot more families on a demand side policy is trying to fit a square peg into a round hole. Really, the system will break. There will not be enough supply. We've seen that in 1990s Quebec. Saw that in South Korea in the early 2000s. That is just true. So I think we need more of that. But I guess I would use this moment to say, I think we don't call it that a lot in our field. We don't think of this like this is supply side and this is demand side from a policy making standpoint. And I think that level of conversation and education, vouchers are being used sort of nefariously in the K-12 system for a reason. They are not a great way to build a public system. I think we need to have that conversation more. So just want to say that.
I want to turn to thinking about scaling. And you guys have all been involved in these kinds of conversations. So how do you move from where we currently are to where we want to be? And so in the various policy efforts in which you've been involved, how have you thought about sequencing the components of a policy, or sort of building up? And maybe I'll start here with Janet. I know you guys have very recently been thinking about how exactly to do this.
Yes, absolutely. This was a really key part of the discussion in Vermont as part of building towards in 2023 pass of a major child care bill. You'll hear similar themes to what the Secretary was sharing earlier. I joined the Scott administration as the bill this 2023 bill had passed the Senate and was heading to the House side, and so I was really focused on creating we were all really focused on creating like an implementable bill, right? Like I wanted what we were getting to be something that we could actually take and run with, and we weren't gonna trip, and that really required us to balance the revenue sources, the technological capacity, right, within state government. And just readiness in the field overall. And so I do have a couple notes on the things that we did. So the first was investing in program sustainability and viability right away. Like, no one wanted programs closing while the bill was kicking in, right? Like that, like nothing gets more press than programs closing and negative press. It just takes the wind out of everybody's sails. So the legislature created a $20 million readiness fund for programs. And it was just as ARPA stabilization was ending. So it really filled a key gap for these programs in their budgets as we were able to get as we were working to get the rest of the bill in place. And we were actually able to use the lessons we'd learned from distributing the ARPA money to create a really streamlined system. So that was very helpful. The state also used general fund dollars to increase the amount the state paid on behalf of families on subsidy right away. The bill went to law in late 2023. Higher rates were in effect in July. And then another increase of 35% of the rates went into effect in December. And I will say, this is super in the weeds, but neither of those changes required us to update our IT systems as the state, and that was really important for us being able to move quickly. The most controversial part of this bill was the fact that we needed a new revenue source to be able to expand eligibility for financial assistance. The governor had identified $56 million of general fund, new general fund investment that he was putting on the table, and the legislature, of course, said thank you very much, and we'd like some more. And so the legislature, they evaluated different options. They decided on a payroll tax. So in Vermont, we've created a child care contribution special fund funded by a payroll tax, and the payroll tax is 0.44%. And it's split between employers and employees, with the employers paying more. So for example, if somebody makes a household that has 70K in wage income, they are paying there's $308 of tax collected from them, $231 is paid by the employer, and $77 is paid by the employee. So this is, but a pretty small tax, right? I mean, but it's spread obviously across all wage earners, including self-employed folks. But our Department of Tax needed time to stand up that tax and begin to collect the revenue. So that was happening a year later. That was July of 24. And then on October 1st of 24, Vermont rolled out eligibility expansion up to 575% of the federal poverty levels where we're at, which is about $190,000 in gross household income for a family of 4, and that's the upper limit. So for one glorious year, we got to say we had the most financially inclusive program in the nation, and then New Mexico eclipsed us. But we do, at this point, we do have 72% more children being supported with child care financial assistance, and our state is paying out about 3 times as much money through child care financial assistance as we did before, between the combination of increased families and increased subsidy.
Great. Mario, how about you? How have you thought about sequencing, scaling in the context of policies you've worked on?
It's a good question. I don't always think about them in the same way. So sometimes the sequencing side of things, you just do what you can with the time that you have. And so that was certainly the orientation that we had in both of my times in different administrations. And so during the Biden administration, a number of the different policy councils put together an executive order to advance high quality caregiving. So not only to make improvements in childcare, but also family caregiving and long-term care. But trying to address the structural issues that exist across all care, which is low wages for workers, inadequate supply, poor options for families, and price prohibitions. And so we just did everything as fast as we could. And so that's where you saw the child care rule, the Head Start rule, the Department of Defense put out a more equitable payment pattern for how they reimburse for on-base child care and for off-base child care. The enforcement actions that were taken out of the Department of Health and Human Services on reimbursement rates, work out of the Office of Personnel Management to provide guidance to federal agencies that subsidize child care, work out of the Department of the Treasury to support CDFIs and their work on facilities and financing in child care. And so it was an elegant
It was a busy time.
from a sequencing perspective, but it was mostly just whatever you could do with the amount of time that you had. And there were certain things that we couldn't do either, in the time that we had either. So there's an obscure law that was passed by Congress called Secure 2.0, I believe, which provides automatic 401k matching for workers who are at a certain level of income. I think it's $65,000 or less. And they provide it automatically as long as the 401k plans are set up for employees. And so there was a directive in there to make sure that there was guidance to make people aware of that for care providers and to make sure that they were in a position to benefit from those resources. But they don't kick in until 2027. And so when I talked to the Department of Treasury about it, they're like, get back to me in 2 or 3 years. And I was like, I'm not going to be here in 2 or 3 years. So I couldn't get to that. And then I'll say on the scaling side of things, sometimes when we prepare policy, especially big optimistic things, so much of it is constrained by things that people wouldn't anticipate because they don't make a ton of sense. So when you're making budget recommendations, for example, you just have to fit it within the 10-year budget window. So you do the best you can within the 10-year budget window, and you make the best assumptions that you can too in terms of what take-up might be for a universal child care program that is capped at $10 a day, for families. Or a universal preschool program that might have a state match component for states. You do the best you can. And there's a lot of guesswork that's involved. And it's deeply imperfect. So at the federal level, I feel like it's far less precise than at the state and local level. Because, I don't know, you're dealing with real things all the time.
They're nodding along, so there's broad agreement on that.
We've seen it. No, we haven't.
Sarah, how do you think about rolling out and scaling?
Oh gosh, learned a lot about it, but I agree that there's always constraints that kind of require you, whether it's the political will to just do something now, so you do it for everyone, or just the practicality of you can't really start with 0 because where are they going to go when they're 1? So that's why a lot of states, start with pre-K 4 and move on down. But what I have definitely learned is if you don't always have a finger on the scale of the supply for especially infants, especially very young infants and toddlers, that any decision you make is going to reduce the supply and access for families with infants and toddlers to childcare because they're expensive to serve, they're hard to serve. A lot of programs aren't currently serving them in our environment today because of that. And so we saw that with wide expansion of universal pre-K. I think you see that in the expansion of childcare. It has mostly benefited school-age children, and preschool-age families are people who are already in the system, who are getting childcare. So I think those are the 2 groups to always keep in mind. Is infants and toddlers is one group, even though wide developmental range, and families who aren't in childcare right now and who can't find childcare. I think you always have to design your policy to think about them.
Great. I'm cognizant of time, so I think what we're going to do is we're going to move to a lightning round where I'm just going to direct a question at each of you for a quick response, and then we'll open it up to audience questions. Mario, I think it is fair to say that the federal level backdrop has been somewhat uncertain recently. And so how do we think about policymaking at the state and local level against that, against the major threats to childcare infrastructure, the uncertainty that's occurring? An easy lift there.
Yeah. There's a high amount of volatility that is being introduced by the federal level. But I was talking about this with Janet beforehand. One of the things that's given me a lot of hope recently is the work that is happening at the state and local level, because they are continuing to do great things despite all of the mess that is emerging from the federal level. But I have to say that it concerns me a great deal, because I know that some of the things that are happening at the federal level, if they gain any sort of purchase, that it could really undermine some of the things that are happening at the state and local levels. And so there's this tremendous focus on program integrity and fraud that is contributing to a really counterproductive conversation, I think, with respect to the administration of early care and education in the United States. But it seems as if it's an area where both the administration and Congress are going to continue to devote a fair amount of attention. And I think that is unfortunate. And also, too, there are so many things that are happening that have an impact on early care and education that aren't squarely focused on childcare or preschool or things like that, but have an impact. So the things that are happening with respect to immigration, the funding freezes that are occurring for social services programs, the targeting of certain states, all of those things create a culture of fear and confusion for providers and for families that I think makes it very, very difficult. And also there are actions that are squarely focused on childcare that are going to make it far more difficult for providers to do their jobs. And so if you move, for example, from a way of reimbursing providers retrospectively as opposed to prospectively, or prohibiting or discouraging reimbursement on the basis of enrollment versus attendance, it's going to make it harder for those providers to do their jobs. It's going to make it harder for them to serve families who receive subsidies, which makes it harder for low-income families to get work. And so, I think all of those things are incredibly challenging. Despite all of those things, there are places like Vermont and New Mexico and San Francisco and Massachusetts. Great things are happening at the state and local levels, and I don't want to lose sight of that. And if anything, they're worth. It's progress that's worth accelerating. It's worth studying, and then hopefully, when we're in a period of time again where we can start to think about making big bets on early care and education again, we can look at the things that are working well and place our money there.
That's great. We're still lightning round, so
Sorry.
It's okay.
I'm sorry.
Sarah, could I ask you quickly? We know the ECE landscape is quite varied in terms of types, settings, funding sources. How do you think about building a broad coalition around moving policy forward?
Yeah, you need local infrastructure. I think that is what I would say. Number one, a lot of states have built local coalitions or local infrastructure because the state level, maybe a lot closer than the federal level, but it's still pretty far from the real lives of families and children. And so you need some infrastructure. I get a lot of questions, of course, of like, how can we achieve universal one day? But I think the thing I say back is keep working on that. And in the parallel, you should do things like build really strong systems to engage providers and families and build that into the work that you do every day. And I don't think we've cracked the nut totally, but there's not one answer, but I think the answer or the question folks should be asking themselves is how do I meaningfully collect impact from, collect feedback from providers and families, and who are the local partners or the existing organizations, as you heard me say before, that I could start to partner with now to make that feedback more meaningful and continuous.
Great. And Janet, we've talked about quality a bit here and there throughout. Obviously, very important. How do we think about supporting high quality alongside expanding access?
Yeah, so I would say one of the things that we did in Vermont, one is all of our modeling always assumed high quality, right? We didn't use market rates. We didn't care about those other ones. They don't matter. Like only model on actual quality. Somewhat counterintuitively, we got rid of tiered reimbursement rates for quality. So we are now trying to pay everybody the amount that it costs to offer high quality care, rather than saying earn your 4th star and then you'll get a few more dollars per kid. So then, to incent quality, we created different programs. We actually created real support programs, real scholarships, real student loan repayment, practice-based coaches, and did it in a really supportive side. There are still some financial incentives, but we just changed the approach, rather than imagining that this tiered reimbursement system was going to create the right market incentives for quality in this broken system.
Great.
Also, pre-kindergarten design, can be really important in terms of pushing quality across the whole system if you don't break infant toddler care in the meantime.
Very helpful. Great. I hope you guys have your questions ready, and I know there are mics scattered, so
I'm sorry I wasn't lightning.
Hi, thank you. I'm Jenilyn Soto. I'm with the UC Berkeley, yes, the other school, sorry, Goldman School of Public Policy. And previously, I was with the National Women's Law Center in Washington, D.C., so it's so exciting to see former White House folks from a previous administration. My question is really for Sara and Janet. So sorry. I'm currently working on a tool for local elected officials that's meant to be decision useful for how they can help fix the child care ecosystem. And everyone has thus far already identified the 4-5 primary levers, but something that the two of you mentioned, particularly in being really generative and flourishing and trying to measure flourishing and trying to really quantify and measure quality. I'm curious how you imagine that outside of the state of New Mexico, for example, or outside of the state of Vermont, if local elected officials were to partner with their state level counterparts or other folks in the ecosystem, what would the beginning conversations look like? What first few questions might they want to ask of themselves at the local level and at the state level to get conversations going around how do we make sure that the child care system is flourishing, or it's a flourishing experience for our students, for our kids, and for our families, and then what would we begin trying to measure regarding quality? Sorry, it's a really easy question I posed.
Why don't we take the second part of that first? And what would you want to measure quality? What's the sort of place to start there? I have
Go ahead. No, please.
I was
go
going to say,
ahead.
we're actually, I would say on our side, I mean, we have a research partnership with Child Trends, I mean, and they have a research instrument that really is measuring the various ways that childcare is actually, like families, the childcare has the attributes, right, that families are actually looking for and are developing that scale and should try to understand what are the places where it's working for them and not working for them and how are they balancing those choices. And that's been really, we're just seeing our early data on that, but that's been really interesting from us sort of from a research perspective. Again, from a local like policy making sort of perspective, that tool might be useful only in just sort of saying like what were the questions that were in there, what are the attributes that are in there that a local policymaker would want to engage with their community members about.
Yeah, I would say workforce. Focus on, do people stay in their employment? Do they like their employment? Are their wages going up? Are their working conditions? You have your friends right at Berkeley at the Center for the Study of Child Care Employment who have some great and very easy to use tools to do that. That I think the more we think about lower cost ways also to think about quality. They may not be super high fidelity. Maybe that's an unpopular thing to say in this room, but especially when you don't have a lot of resources to use things like that checklist or self-assessment and measurement over time is like our working conditions getting better. The other thing I would say is when I worked in Oregon, we're going to get what parents want out of childcare, but what parents have come to expect of childcare, the bar is on the ground. Mm-hmm. So they were like, it's safe. Like, oh my God, my child won't get kicked out. Like, oh my God, So I think I would also, measure, and this is just my like very non-researchy hypothesis, do parent expectations of their quality of childcare actually materially change, and how can you move that needle?
That's great. And maybe I'll table for you guys to connect to later so that we can get a couple more questions. I think Catherine.
Hi, I'm Catherine. I'm an assistant professor here in the Graduate School of Education, and most of my work looks at how policies affect the supply of childcare, so this has been really great and insightful. But one thing that I struggle with, and I think many of us in the room struggle with as researchers, is the tension between wanting to say something about affordability and then the lack of data infrastructure that's there. And so I think a lot of times we pull on data sets that are at the national level, and that's not very helpful because a lot of the questions we're asking are more local. And so I feel like that's a very big tension, and I wonder how you think about it from your state's perspective, because I heard like you threw out the market rate survey and we're kind of like, no, we're not going to use this to set prices. So how do you all think about getting that price data, and what would be helpful for you from researchers when you're thinking about this? Because I think national survey doesn't seem to be the trick, but also maybe going to local doesn't seem to be the trick. So kind of how do you think about that?
It's a great question. I mean, I think that, I think the thing that matters the most is out-of-pocket costs. And so I think that's when, there's all the surveys that go out and they're like, Vermont is both like the cost of childcare has like exploded in Vermont, and you're like, out-of-pocket costs haven't exploded for families, and that distinction is not made in a lot of the research, and then are like the things that get pulled into the 50 state metrics and things like that. And so, I mean, that's not a full answer to your question, but that's an element of it that I think would be really helpful when the research is presented.
Yeah. I think we hardly ever look at price data and availability data sort of side to side. So it's great to know the price of infant care, but it's also helpful to know the price of infant care in the context of like there's a slot for everyone in 2,000 infants. But I think more contextualized price data, if that makes sense. I would also say like the cost of entry. You know, we have programs in New Mexico who may charge fees they can't to publicly funded parents, but to be on the wait list, to do this, to do that, you also have to come to an interview. So I think a more comprehensive look of what it really costs families to enter childcare would certainly be helpful.
Hi, good afternoon. I'm Kristen Spanos from Alameda County First Five. So just down the road in Oakland and Berkeley in that county that has 120,000 children ages 0 to 5, we passed ballot initiatives. So we're in the process of appropriating $200 million annually. And I would just double down, I guess I'm offering this up more of a comment, but certainly if there's anything to play off of that. I've heard you speak about the data fragmentation. I would also put it on the finance side. So for someone who's worked in social services really over the course of my career, and now being in early childhood for the past 10 years, the fragmentation in the financials. So 35 different funding streams come into Alameda County from the federal and the state to fund early childhood with different eligibility criteria. And it's one thing, and they come into different, whether it's social services, whether it's the Department of Ed, whether it's First Fives, whether it's directly to the centers themselves. But then the fragmentation also obscures the use of the finance thing already. So there's been this whole play over the past couple of years of like collecting that data to understand the use of the existing money and then having the local money be the money of last resort. And there's something, I just say that to others in the room who are elected officials and thinking about how to streamline that. That would be a tremendous help locally to have the financing more streamlined for easy access and for use and understanding patterns of expenditures and expenses.
Thank you for that point. And I know folks here have worked on those very issues and others in the room. My timer has officially ticked away. So please join me in thanking the panel.